the missing testicle. Cryptorchidism, genetics, testosterone, and when neutering makes sense. When somebody discovers that their male puppy has only one testicle in the scrotum, one of the first questions I hear is, where did this come from? Is something wrong with the bloodline? And after more than 5 decades breeding dogs, I want to slow that conversation down. Because a retained testicle is something breeders should take seriously, but it is also something people should understand correctly. The medical term is cryptorchidism. Normally, a male puppy develops 2 testicles inside the abdomen, and during early development, they migrate downward into the scrotum. When one fails to complete that journey, we call the dog a unilateral cryptorchid. When neither descends, he is a bilateral cryptorchid. And there is another term people frequently misuse, Monorchidism. A true monorchid has actually developed only 1 testicle. That is quite rare in dogs. Most dogs described casually as monorchids actually have a second testicle somewhere, often in the inguinal canal or abdomen, and therefore are cryptorchids. Now here's something important, and this is not a German Shepherd problem. It is not something unique to one breeder, one kennel, or one particular family of dogs. Cryptorchidism occurs throughout the canine population and has been documented across breeds. Similar failure of testicular descent occurs in other domestic mammals as well. But, and this is equally important, that does not mean genetics have nothing to do with it. They do. Veterinary medicine considers canine cryptorchidism to have a hereditary component. What we still do not completely understand is exactly how that inheritance works. Years ago, people tried to describe it as though there were one simple recessive gene. Modern research tells us the biology appears considerably more complicated. Multiple genes may be involved. Researchers are studying genes and pathways associated with testicular descent, body size, hormonal signaling, and epigenetic regulation. And we still do not have a simple DNA test that allows a breeder to look at 2 perfectly normal dogs and say, these 2 will produce a cryptorchid puppy. We cannot do that. And this is where decades of breeding experience becomes very interesting. I have personally bred a female to 1 male and had several male puppies with retained testicles. Naturally, that makes you stop and pay attention. But that same female was later bred to a different male, and there were no affected puppies. She was bred again to another male, again, none. I have seen variations of this throughout generations. That doesn't prove that genetics weren't involved. Actually, it demonstrates why responsible breeders have to look beyond 1 puppy or 1 litter and study patterns across families, combinations, and generations. A responsible breeder records it, studies it, avoids repeatedly producing the same problem, and makes breeding decisions accordingly. But scientifically, we should be very careful about declaring that 1 dog, 1 parent, or 1 bloodline is the cause when the inheritance itself has not been completely mapped. Now let's talk about the dog himself. A unilateral cryptorchid male may be completely fertile. That normal testicle can produce sperm. And importantly, the retained testicle can continue producing testosterone. So this dog can look masculine, behave like a normal, intact male, and develop normal male secondary sexual characteristics. Having a retained testicle does not automatically mean that he is hormonally deficient. But because cryptorchidism is considered heritable, he should not be used for breeding. That is the part I feel very strongly about. If we know a dog is affected by a condition with a hereditary component, there is no legitimate reason to intentionally put that risk back into a breeding population. Then comes the question I hear constantly. Why not simply neuter every male puppy very young? This is where veterinary thinking has changed. Sex hormones are not useless substances that suddenly appear only for reproduction. During development, gonadal hormones participate in sexual maturation and interact with many physiological systems. And research on neutering has shown that age matters, particularly in medium, large, and giant breeds. Studies have found associations between very early gonadectomy and increased risks of certain orthopedic problems in some breeds. That does not mean every dog must remain intact until exactly 2 years old. There is no scientifically defensible universal age that applies to every dog. For a large breed such as the German Shepherd, I prefer an individualized discussion with the veterinarian that considers skeletal development, size, health, lifestyle, and in this case, the location and condition of the retained testicle. Once the dog has reached physical maturity, however, the argument for preserving reproductive capability in a cryptorchid dog becomes much weaker. He should not be bred, and leaving a retained testicle inside the abdomen or inguinal canal carries risks of its own. Retained testicles have an increased risk of developing testicular neoplasia, and they are also susceptible to spermatic cord torsion, in twisting of the testicle and its blood supply, which can become a painful surgical emergency. That is why veterinary references recommend surgical removal. And normally, we don't simply remove the hidden testicle and deliberately preserve the descended one. The standard recommendation for a cryptorchid companion dog is removal of both testicles. Why? Because leaving the normal testicle leaves the dog fertile and capable of passing along hereditary susceptibility. And there is another misconception I want to address. The people sometimes worry, if I remove his testicles, will I take away his confidence? Will he become unhappy? Will he stop being himself? Testosterone influences physiology and behavior, but temperament is vastly more complicated than a testosterone level. Confidence is built from genetics, neurological development, early experiences, socialization, learning, environment, and the relationship the dog develops with the world around him. Neutering is not an eraser that removes a dog's personality. And keeping a retained testicle simply because we believe the dog needs testosterone for emotional happiness is not a sound reason to expose an adult dog to the medical risks associated with cryptorchidism. So if you discover that your puppy has a retained testicle, don't panic, but don't ignore it either. Understand what it is. Understand that there is a hereditary component. Don't breed the affected dog. Allow your veterinarian to determine where that testicle is located and discuss the appropriate timing for surgery based on the individual dog. And above all, don't turn one developmental condition into a simplistic accusation against one dog or one bloodline. Breeding biology is rarely that simple. After more than 50 years of watching generations of dogs develop, I have learned that good breeding is not about pretending imperfections never happen. They happen in living animals. Good breeding is about recognizing them, recording them, studying the patterns, making responsible selections, and never stopping our education. That is how we protect the dogs that come after them. Alt Maria Cecilia Martinez, Southernwind, Kennels.
Thank you for sharing these few moments with me. It is a privilege to pass along the knowledge and experience I have gathered throughout more than 52 years of living, working, and learning beside these remarkable dogs. I hope this video has given you something meaningful, perhaps a new understanding, a different way of seeing your dog, or one lesson that may improve the life you share together. If it has, stay with us and continue learning with Southernwind, because when we understand our dogs more deeply, we do not simply become better owners, we become more deserving of the trust they place in us.